So other than patients with dense breast tissue, who would you recommend an ultrasound for?
So breast ultrasound, if a woman does not have dense breast tissue, is a useful tool for screening in young women. So for example, if a 25-year-old girl comes to me, the first important tool is ultrasound. We do not jump onto screening mammography because mammography is usually used after a certain age. So it's a first tool for young patients. Secondly, it's very useful for patients who have undergone mastectomy and now feeling lump or pain. So patients who don't have breast but have flap tissue or post-surgical new implants, ultrasound is a great tool. Thirdly, ultrasound is a great tool to evaluate for lymph nodes in the axillary region or the armpits region. Mammography cannot be used for that. Fourthly, ultrasound is an adjunct to screening mammography, especially in patients who have dense breast, implant tissue, patients who have undergone surgical scarring. And last but not the least, ultrasound is very useful in patient who is coming in with a new lump, new pain, new mass, something in the skin or subdermal region. So there are several usage of ultrasound. We are proud to say that we use high resolution ultrasound techniques, which also include elastography and 3D ultrasound, which lets us differentiate from normal tissue from abnormal tissue very easily.
You briefly mentioned breast implants just a moment ago, and I wanted to know, why is a breast ultrasound so important for a patient with breast implants?
That's a very good question. I wish this could be played to everyone before they're getting implants. So getting implants is great for cosmetic results, but one should be aware when they undergo breast cancer screening, how would that affect? So for example, when one patient has implants and she undergoes mammography, we have to perform implant displaced views in which the breast tissue has to be pulled away from the implant and then compressed in the mammography. Imagine not all tissue can be included in it because there's tissue very close to the implant which cannot be necessarily included in mammography. Therefore comes the ultrasound, because ultrasound is it's a simple, easy probe which is non-radiating, non-ionizing radiations and painless and simple, where we can check the areas in the breast which could not entirely be checked by mammography due to implants.